Welcome, and thank you for joining us at the Creative Healing for Youth in Pain, or CHIP webinar today. Our topic is migraines in teens. Yes, it's in their head, but not how you think. For those of you who are new to our community, CHIP is an online organization that empowers youth living with chronic pain to heal by altering the brain pain circuits through exposure to creative healing experiences, educational resources, and peer support. I'm Dr. Shelley Siegel. I'm a clinical and health psychologist with a private practice in Calabasas, California, and have a voluntary clinical faculty position at UCLA in the Department of Adult Psychology and the Health and Behavior track. I've been working with CHIP's founder, Dr. Lonnie Zeltzer, since completing my postdoctoral fellowship at UCLA, where she was the director of the pediatric pain program. I continue to collaborate with Dr. Zeltzer and our multidisciplinary team, and have been working at both Whole Child LA and CHIP with our deep commitment to mind-body well-being. Our speaker today is Dr. Mark Connolly. He's a clinical and health psychologist and professor of pediatrics at the University of Missouri, Kansas City School of Medicine. He has over 20 years of experience helping kids and teens with headaches and chronic pain, and has led the hospital's integrated pain management program and comprehensive headache clinic. In addition to caring for patients, he's published widely on pediatric headache and pain, and his research has been supported by the National Institutes of Health, the National Headache Foundation, and several other national organizations. Please enter your questions in the Q&A section throughout the webinar. I will incorporate the audience questions into our conversation. The chat is open for discussion, but I can't guarantee that every conversation will be able to be addressed. Thank you for joining us today, Dr. Connolly.
Thank you so much for having me.
I'd like to start by asking you how you initially got involved in this kind of work.
Sounds great. Yeah, listening to you and how you introduced CHIP in particular overlaps a lot with my interest in this area, more from the perspective of just the power of the mind and really understanding more about the mind's interaction with the body. So I really got interested in that as I was going to school and kind of grad school and those type of things. But really towards the end of my graduate school training, really got interested in this area of pain specifically, and migraine being a really kind of interesting model within that of how much we're really understanding this interaction between the brain and the body. And it was not ironic that I titled our talk today as I did, because I think, as you think about psychology and psychology's role in the area of pain in particular, it is one of those areas of medicine that I think we have really pretty impressive things to offer in terms of our understanding of, again, that interaction between our minds and how we kind of think about things and our actions and health implications for that. So migraine for me has been just kind of really an interesting model of understanding better about that interaction between mind and body, and really making use of psychological science in a way that kind of supports kids and parents from understanding that migraine and pain are very real and there's physical components to them, but can be influenced in a really positive way by applying some specific strategies and coping techniques and so forth. So, yep, I think it dovetails really well with CHIP.
Well, thank you. Can you tell us what a migraine is and how it's different from other headaches?
Yeah, I think oftentimes that distinction gets a little bit more blurred at times, and sometimes people that would call their headaches migraine might be having a migraine. But I think the main thing is migraine isn't just a really bad headache. It's frankly, it really is considered a neurological disease and a cyclical neurological disease, in the sense that parents would know this, but even in between times when you have headaches, there's other kind of symptoms that kind of linger in the background as well. And then when the headache phase comes on, there's often a number of other symptoms beyond the headache that happen with migraine that make it fairly unique. So those are things that include like a lot of sensitivity to things like noise and lights, even smells at times, nausea and vomiting. So more kind of stomach upset that happens with these type of headaches. Just a lot more just kind of general sensitivity and then dizziness sometimes. Some kids will experience kind of visual changes that happen right at the time of a headache as well. Sometimes mood changes or just a lot of energy drain around this as well. So beyond the headache itself, there's just kind of a cluster of symptoms that come on with these type of headaches that make migraine a little bit different. And as you can imagine, all those symptoms have a huge impact on kids' day-to-day activities and often interfere a lot with family activities as well.
Oh, absolutely. And we'll get to that for sure. Um, why do migraines happen?
So
And what do we know about the causes?
yeah, and I think that's one of the more exciting areas as we think about migraine and pain more generally, is that there has been a lot of increases in our knowledge about why migraines happen and kind of what's happening in the brain, and really viewing it as much more of a brain condition or neurological condition, like you said. So I think there's a couple metaphors that might help. I like the storm metaphor, and parents might resonate with this. So if you kind of think about the brain as being a cloud in some way, or brain being a sky, I should say, that and most days it kind of looks generally calm, but in kids with migraine, their atmosphere tends to be a little bit more cloudy or charged up, if you will, even if there's no kind of storm happening. But then over time, what happens is sometimes the clouds are holding a lot of static electricity, and if the conditions are just right, so for example, if you have stress or skip meals or too much going on, getting overwhelmed and that kind of stuff, at some point, it that kind of sends a charge or like a lightning strike all the way through the rest of rest of the brain. And so what's happening in the brain as a migraine happens, it's kind of almost like resetting. It's shutting down as this kind of electrical wave moves through the entire brain. And one way I like to describe it to parents too is it's this idea that the brain is almost using that time to reset itself. So it's almost helpful in some ways in that the brain is getting overloaded. It needs to do like a reboot to a hard reset, if you will. I mean, so what happens as that reboot is happening is it releases some chemicals that cause that kind of inflammation and our understanding of pain, right? So the chemical changes that happen in the brain send that pain message that ultimately gets perceived by kids as that throbbing thing. But all those other symptoms that I described, like the vision changes and dizziness and sensory overload, that wave of electrical changes are going through the brain, kind of from the back all the way to the front. And so the brain kind of just shuts down and has all these other symptoms in addition to pain develop at the same time.
So sometimes they do have like a prodrome, or they have a warning
Yes.
sign,
So that's
right?
yeah, absolutely, and that's a little bit unique. Not everybody does, but that's fairly unique for migraine as well. And if you kind of use that storm model, if you will, it's kind of again that storm building up. You have some symptoms that are happening at that time, and that word again, the prodrome, what happens right before, just as that threshold is getting met to go into that migraine headache phase. There's some changes that are happening that some kids are pretty alert to, and frankly, that sometimes scares parents too, because a lot of these symptoms, even though they're safe when we talk about migraine, they can be pretty scary because they do look like neurological symptoms, right? They might even see new things or lose some fields of vision or those type of things. So that can be obviously pretty frightening to parents that don't know what's going on when it's happening.
Are there triggers you can talk about that may be common? I think you've mentioned a few kind of with, um, you know, well, I'll wait and let you tell us.
Well, frankly, that's a good pause there because if you can fill in the blank with essentially anything, and I think that's the challenge, is that there used to be a fair amount of research really looking or attempting to look at very specific triggers. And I would say I don't want to dismiss the fact that for some kids there is probably reliable triggers, and we can kind of talk a little bit about the common ones. But we've done some research in this area and others have as well. And I think the recognition is it literally anything can potentially be a trigger. So it's really hard to kind of identify that. It's so idiosyncratic or individual to any given kid. So it's not like let's say chocolate, for example. Some people have identified chocolate as a trigger, but it's very unreliable. It's unlikely to be that common for a lot of different people. So then should everybody avoid chocolate as a possibility? And that's the other challenge as we talk about triggers is I think sometimes well intended, but the idea of just trying to find your triggers and spending a lot of time identifying them and then trying to avoid them is not really the best treatment approach, even though that's kind of the older treatment approach that we used to recommend. So I think based on that, the common things to pay attention to is just when the body feels overwhelmed or overloaded, if you kind of understand that model, then kids with migraines are more likely to go into that migraine phase because the brain is basically saying, I've had enough and I need time to reset. So the general wellness type of things, general stress management, all of those things are more important probably than really trying to identify really specific foods or sensory conditions or those type of things as well. It's just doing things that we know are healthy for the brain and learning some good again mind body stress management strategies that we can talk about as we go.
Okay, so for instance, getting enough sleep. So when you say lifestyle, sleep, maybe diet, exercise, integrating that into a healthy lifestyle.
Yep,
Are
and
you
I think again, kind of going back to your interest in with the organization, Chip. I think if you think about, oftentimes we don't even think about how do you take care of your brain, but when we know this is kind of a condition of the brain's health, then understanding what does the brain need to function well, and those are all the things that you mentioned. So lifestyle to me is really how do you actually keep your brain healthy. We talk a lot about heart health or some right other areas, but we often don't actually talk about what does it take to keep your brain healthy, and those are all the general wellness stuff that you just mentioned there. So I think getting good sleep, which obviously is challenging as we talk about busy lives and the times that school starts and all the like society isn't really well set up to support that. But nonetheless, yes, trying to protect sleep and know good sleep strategies so that you have good sleep routines, get nutrition and staying really nutrition specifically staying consistent, not going long periods of time where you have nothing, no energy to operate on, right? So it's more the being consistent with how frequently you're eating, not skipping meals, those type of things. Exercise is obviously really beneficial for brain health, and so tying in physical activity and just kind of general movement and those type of things as well. And then water intake. It's not like drinking enough water is fixing migraine, but it's still the idea of those are good strategies to keep your brain as healthy as possible. So drinking lots of water. And the other thing I'll just say about lifestyle stuff that I think has been challenging as well is it's not that you're having migraines because you're doing poorly at lifestyle. It's not like that shouldn't be the message to parents. I think it's more just getting into good habits are going to make any other treatment that we might recommend for headaches work better, right? So if you're doing a good job of taking care of your brain's health, then all the other treatments don't have to fight as much of an uphill battle to do what they're supposed to do. So yeah, I think it's again general lifestyle, general wellness. We could talk about other strategies in that category, but things that are good for most people are even more important to be sensitive to when we talk about lifestyle recommendations for kids with migraine.
And that's a big aspect of what psychologists do, really. Again, like we talked about from the beginning, the mind body and how integrative a psychologist is to the pain team.
I think it is definitely there's a role for that. Yes, I think also the idea, and you mentioned kind of coming from a team background as well. I think the challenge of psychology's role in this is certainly not to suggest that it's again lack of stress management techniques or a mental health problem or disorder in any means. It's taking advantage of what we know in psychology and applying that. So, for example, as we talk about lifestyle stuff, if everybody was great at lifestyle, it was easy to do, then you probably wouldn't need much science behind how do you actually develop good habits and healthy habits and what are strategies to make it work when, again, school schedules and all that kind of stuff don't make that super easy. So part of psychology is really using psychological science or behavioral science to support adherence with other treatment recommendations. And then also, again, understanding the value of how we kind of think about things and using our mind for regulating ourselves, managing our stress well, and those type of things. That's the other area that psychology fits in. But psychology doesn't fit in to say migraine is a psychiatric condition or a mental health
No,
condition by any means. And I think, unfortunately, families sometimes hear that when psychology is kind of involved, and that's definitely not the accurate depiction of psychology's role in this.
right. And sort of to piggyback on that, I mean, there are a host of other issues that go along with having a migraine. For instance, how does it impact a teen's school life and their life with their friendships?
Absolutely. So I think that's one of the most important areas to recognize as well. The World Health Organization, interestingly, and I tell this to parents, I think it's important to know that migraine, by the time you're in your middle teen years, migraine worldwide is the most disabling health condition. So, and there's ways that they kind of have a formula for that. And I won't go into those details, but I think just recognizing that if you think about all the disabling health conditions and all the impact that you might know of, the fact that migraine is up there and frankly, again, at the top of the list suggests how impactful this is. And that becomes really important as you think about advocating for kids with migraine. It is very different than a headache, right? So as we think about advocating for school and really helping with some of those impacts from this, recognizing how impactful migraine is on day-to-day life for kids is really important. And again, worldwide, that this has such a big impact on work and school and family and so forth as well. But yes, to your question specifically, I think school is probably one of the biggest areas of impact specifically for migraine and kind of pain in the head. I work in other pain areas as well, and I just feel like just the idea of having migraine and those symptoms that are more, again, located around this area, the idea of trying to convince kids how you still pay attention and concentrate and still function in the school environment. It's a little bit different when it's like still hard with other parts of your body, but the idea of how much mental energy goes into sitting still throughout the day and trying to understand and learn, I think school is a huge impact. And unfortunately, the result of that is sometimes, there's just not a lot of support or there's not making progress in school. And some kids drop out. The school participation for migraines in particular is significantly reduced relative to other health conditions as well. So that school impact is huge in migraine. And then obviously, as you mentioned too, just the social participation, being able to have the motivation to hang out with friends. But as I said, even between migraine episodes or migraine headache episodes, there's still kind of the after effects or what they call postdrome. So oftentimes lower energy or more fatigue and that kind of stuff. So it becomes really hard even when you're not having a migraine to still have the energy and motivation to participate in all the things that are important for kids with hanging out with friends and doing sports or clubs and that kind of stuff as well. And then the other thing that sometimes gets neglected but relevant to today is just a huge impact on families because families often either are anticipating, well, if we do this, then that might make a migraine happen, so we better not do whatever it is, X, Y, or Z. Or, for example, even planning vacations. Oftentimes parents have to change around what they're thinking about for the vacation or won't go certain places because they're worried about that. Or just the day-to-day rhythms for families totally change when they're not necessarily sure when the next migraine is going to come or how to respond to that as well. So family, parents' mental health and or siblings and all that kind of stuff gets impacted at the same time from kids that are dealing with migraine. So yeah, a huge impacts, and that's even just scratching the surface. I think there's a lot more
Yeah.
to drill down to into the impact that this has on a kid's life and family's life.
So really, what I'm hearing too is that there's a big impact on the family. So the parents, the siblings, but let's say, what can parents do for their teens? How can they advocate for them at school? What kind of recommendations do you have for that?
Yep, absolutely. I think in terms of maybe I'll go with the school first, and then I'll kind of come back to some other things to do at home. Because I think the school is a big one for parents to know about and have a role in supporting. So as parents might know, there's a couple different options for school supports. One is more the kind of a 504 plan that's really designated for people that are having any health condition that has an impact on their day-to-day functioning, which does include things like learning and paying attention and concentrating and all the type of things as well. So I say that because if you are attending kind of general education at a public school, then you are, just by virtue of this diagnosis, qualified to get what's called a 504 plan. And I'll talk a little bit more about what that can involve and how to go about doing so here in a minute. And then the other plan for kind of accommodations at the schools, what's called the individualized education plan. And some parents might be familiar with that as well, but might not know that migraine can be something that gets you qualified for an individualized education plan too. The difference is individualized education plans are generally more for kids that are having significant learning impact at school. So academic failure, for example, or being behind in credits and those type of things, just really or absenteeism, or missing enough that they're not keeping up. So typically it's more that they're really struggling with the learning and need more specific learning supports. So for example, just extra teacher time or extra tutoring, or even paraprofessional support at the school, those type of things as well. Most of the time, the 504 plan works fairly well, but I do point out those differences because migraine can qualify for an individualized education plan. And some schools, the individualized education plan or IEP, they're just it's it's more binding if you have that in place. So typically it's a little bit easier to make sure an IEP is being implemented, and a little bit more challenging for some schools with the 504 plan. But the common recommendations with the 504 plan, specifically, things like if kids are missing a lot of school, we definitely want to have a plan for getting them there as often as possible, but recognizing that a lot of flexibility with that attendance is going to be important. So for kids that are missing a lot, we really talk about kind of these gradual reentry plans, where we really kind of just shoot for, let's stick with a goal for now of being there for a couple class periods. That's the expectation for now. We'll start building that up over time. That can kind of fit into this 504 plan. More simple things like having access to snacks and water throughout the school day becomes really important. It's fascinating how many school rules kind of make that difficult to even get out to, get a drink or go to the bathroom and that kind of stuff. So flexibility around that, recognizing it's important to adapt that school, what the school looks like, that school environment for kids that have this and other health conditions. Testing can be built into 504, so being put in a kind of separate testing environment, or having extended time for test or breaking up testing periods, because we know that when you're dealing with migraines, your ability to focus and do things as well as other students is going to be affected. So that can be built in as well. And then, yeah, I think a number of other things, modifications to physical education and those type of things can be helpful as well. So there's a number of things that can be built into a 504 plan, and I think parents should know that you are eligible to have a 504 plan set up for kids. And even if they're not having a significant impact with the migraines, I do typically recommend that it's really helpful to go ahead and have that communication with the school that my kid has a history of this, and to set up something just in case you need it and it's there at least. The IEP plan, or individualized education plan, I'm happy to take questions on. It's a slightly different approach to getting that set up. It requires a little bit more on the parent's end, but definitely be aware that 504 plan and asking for that to get set up for kids is a really helpful part of part of advocacy at the school. The other part of that question you mentioned is just kind of what to do at home. And I think that's the biggest challenge for parents, is ultimately you can't take this away from kids, or it's their own private experience, and there's nothing you can fix as a parent. And the other challenge with parents is we definitely want parents to feel like they can help create a kind of comforting, positive environment at home for if a kid's having a migraine at home. So doing things like trying to keep the noise level down in general and lights off, that kind of stuff as well, is certainly fine. But we don't want to necessarily don't want to necessarily always kind of feel like you have to change everything about the home environment and that kind of stuff in response to this too. So I think being mindful of having a place to go, getting some rest, having access to water and that kind of stuff, and parents supporting that. The other thing I tell parents is if you have a plan in advance, then it's much more easy to implement that. So plan in advance, meaning, let's say this is more of a mild headache. What is our plan for if it's a milder headache? Let's talk about 3 things we're going to do if it's a milder headache. If it's a moderate to severe headache, what is our plan for that? So kids and their parents kind of talk together about, here's a plan for dealing with different levels of that headache. And you already know in advance, I'm going to take if you're prescribed a medication or something over the counter, I'm going to practice some breathing techniques or mind body type of things, going to get some water, going to rest a little bit. You already have a plan worked out, so you don't have to think in the moment what we're going to do, because that tends to bring on a lot of emotions and anxiety about, I just don't know what to do. I can't get this better. And parents not sure what to do either. So anticipating and having a coping plan essentially in advance is really helpful.
Okay, so that fits in, and maybe you've answered quite a bit of it. is Dr. Zeltzer asked, you've been the most well-known researcher on mind-based strategies to help kids with migraines. Can you describe some of these, and should patients ask their therapist to implement these? So strategies
Yeah.
and how to implement this.
Uh, that's a great question. I think that how to implement is a really good question in particular. So I am not aware still of science necessarily strongly distinguishing that this one relaxation strategy or one mind-body strategy is significantly different than another in the sense that they're trying to achieve the same thing. This idea of how do we learn to regulate how our bodies respond to the environment. That's the key as we talk about migraine. How can we essentially decrease that sensitivity, decrease that sensitive brain? So when I say that implementation is a really important
Yeah.
part of this, it's not as much about should I always teach my kid this one strategy, and I'll go over a couple of, but I want to get at the point. For psychology, a lot of the key is how do we actually get kids to develop a habit for practicing mind body strategies in a way that they'll actually stick with. So it's much more how can we find a rhythm and ways to fit this into their daily life that they're willing to commit to and stick with. And every kid is a little bit different. So I typically will start with the most basic of if let's just talk about the power of breathing as a simplest of right mind body strategy. Why is breathing such a powerful strategy for
Mhm.
relaxation? I mean, it sets such a pace for our bodies. Our brains obviously are paying very much attention, if you will, to just the rate of our breath. So the simple idea of developing a habit day to day where you take a little bit of your day, you slow down, you focus on how am I breathing right now, and you change your breathing to become slower and focus on the simple process of breathing with your stomach more than your chest. There's lots of different breathing protocols, if you will, but I keep it that general. The idea of proactively, can you just take a couple minutes of your day to focus on your breath and breathe with your stomach rather than your chest? If you can start as simple as that, then other mind body strategies can build on that. But the point is, how do we get you into a habit of taking a bit of your day? It can be small to start with because that's how habits build, right? We can build on that.
I
But I think then we can introduce some of the other mind body strategies that tend to take a little bit longer, but are really good as well. Some of you might be familiar with like things like mindfulness training, which I think is a great one. However, the kind of protocols for mindfulness tend to be like 45 minutes a day of practice. So obviously getting to that point, it's going to be challenging if you say this is where we need to start. But I love mindfulness is a great one. And I think some kids really gravitate towards this idea of mindful meditation or mindful practice where, again, proactively, you're taking a part of your day to kind of slow things down, but you're just focusing on observing your experience, which is kind of the key for that type of meditation as well. And there's lots of different resources and scripts that help practice mindfulness, but it's just really this idea of can you actually just be present in the moment without your mind having to kind of drift to the past or what's going to happen tomorrow or your physical sensations? Can you just contact the present moment and observe what's happening without trying to judge or evaluate and that kind of stuff and building that skill into your daily life? So I think mindful is a great one. There's progressive muscle relaxation techniques, which are
yeah.
fairly easy to learn. You obviously know a lot of these as well and implement them, I'm sure, in your practices, but being aware again, awareness of how you store tension in your body. It's a series of developing, basically increasing tension in different muscle groups and then releasing that with the idea being you can actually train your system on just as you relax, kind of practice this, as you relax, you kind of pair it up with like a word or expression like chill out or calm down or relax. Over time, as you practice it consistently, kids can actually learn just to fully relax their muscles just by simply saying relax because they've trained that association with that relaxed word or phrase by doing those type of exercises. There's yoga, creative, obviously creative, there's so many different varieties of this self-regulation relaxation strategies. But for parents, the kind of key is we want to support kids on finding something that they can develop a habit for, as in they're willing to practice on a consistent basis. And so it's not that we're expecting that if you breathe, right, if you slow your breath down, then migraines are gone for the rest of your life. It is, can you tie this into your day-to-day life? That is the point of success, not has it fixed your headaches or gone. I think, and I emphasize that a lot because I have a lot of families that come back to that as well, is what does it mean to be helpful or kind of fix things? Don't go in with the expectation that you're trying to fix or make pain better right away. It is, we have to start with developing these kind of lifestyle habits, and particularly early on. If kids get this early on, they're much less likely to have problems with migraines down the road. They're training, again, their brain on how to chill out and calm down at a much earlier stage of life, and that does change how the brain functions in later life. So I know that's a lot to unpack, but in short, kind of my summary point is I don't really care what mind body strategy kids learn, and there's not evidence that one is going to be better than the other. Just find one that you'll be willing to practice and be curious about. Even if it seems kind of goofy to start off with, get into a habit of having a part of your day spent on these relaxation or self-regulation strategies.
That's really helpful. I'm thinking about the impact on mood and maybe increases in anxiety for the teen, him or herself, as well as the parents. But I think mood is and anxiety are comorbidities
Yes.
that sometimes precede or sometimes, you know, become more noticeable with
Yep.
with migraines.
Yeah, I
Could you?
like.
Yeah.
So that again kind of gets into that area where I don't want to necessarily suggest that because a kid has anxiety, and I know you're not doing this, but just because we get into this sometimes, the idea that yes, there's definitely an overlap. If you have a history of migraine, you are more at risk to have anxiety or depression either before migraine problems have started or after. But we definitely, again, don't want to suggest that depression and anxiety are what drives the migraine problem. It's a different mechanism, but it has some overlap as well. So the good thing I think that can tell parents is a lot of the strategies that we recommend for helping with migraine, a lot of these mind body things that we've been talking about, and some other treatments that I can talk about in a bit too, have an overlap because of how things work in the brain. They can be very helpful for anxiety and depression, right? We talk a lot about relaxation strategies, particularly for anxiety, and those mind body techniques can be helpful for that.
Mhm.
Interestingly, a lot of the medication classes, or at least the particularly earlier medications for migraine, are often anti-anxiety medication, antidepressant medications, because they have some benefit on preventing migraine in the future as well. So clearly a lot of overlap. And then, as you can imagine, I think, moving away from all the activities that give you value and give you meaning in life, that's a good recipe for getting pretty sad and isolated and having those depressive symptoms as well. So similar to migraine, some of the behavioral techniques as we think about depression is, even though you're not feeling or not having a lot of hope or not feeling a lot of energy and so forth, how do you kind of find ways of getting some of those activities back in a way you're kind of pacing them, but not fully avoiding things that give your life meaning and value. It's we're kind of programmed as humans essentially to do that when you're not feeling really good or kind of having the head pain, right, and significant headaches. Start avoiding things that potentially can make that worse and that kind of stuff. But as you isolate, then it's harder and harder to ever get the energy and want to do that back. And that's again similar for depression. How do you actually start selecting activities that you don't overwhelm yourself by getting into, I don't have to wait until I really feel good, really feel happy to do this. This is important for me, and I'm going to take a step in the direction of being with a friend, hang out with somebody that's important for me, doing a craft,
Yeah.
doing exercises, whatever that is. So how can you slowly walk back and gain control of your life again so that migraines don't kind of sneak in and start taking that away? So yeah, I think a lot of the overlap for migraine treatment has a lot of overlap with helping with anxiety and depression. But clearly, if kids are really struggling with things like significant anxiety that's not getting better and depression that's not getting better with anything that you're doing. There is a justification for kind of treating those potentially as quote separate problems as well, where you actually have a team that's working a bit more on getting help for the anxiety and depression. And again, happy to address questions about how to do so and when that might be indicated if that would be helpful.
Okay, I mean, I'd like to hear more about that. A question came in about going back a minute to the mindfulness and the breathing. Are there certain apps that you recommend for kids, for parents, for kids and parents to do together?
Yep. Uh, I will make that the easy one is whatever they will use. So going back to that. But yes, in terms of recommendations, I think the people might be familiar with, and I think you might have resources on this. But Imagine Action is so it's I think it's like it's Stanford's Imagine Action. I'm
Okay.
happy that is a really good one. They're just audio files that's and it's kind of divided out into I want help with sleep or I want help with stress or that kind of stuff. But it's a nice introduction into mindfulness in particular with kind of brief snippets of mindful meditation. There are other ones I like to recommend, not because I want to usher people to our site. I don't get benefit from this, but we have put together what's called the headachereliefguide.com. And if you go to the relax section of that website, there it teaches you progressive muscle relaxation with kind of a 3D animation to show you the steps of progressive muscle relaxation. You can access it on your phone or the internet. Also has kind of a breathing pacer for how to learn how to relax your breathing, the stomach breathing I was talking about, and then some of these imagery techniques that are there as well. Comfortability is another great website and can be accessed on the app as well. So there are lots of different relaxation apps, and I do kind of have a handout of relaxation apps that I feel like are pretty good. The challenge is some of those tend to change pretty rapidly over time, so it needs to be updated. So I'd say stick with kind of the ones that we know are going to stick around, and those are, like I said, the ones that I mentioned to you, I think are pretty good. But again, if your kids find one that they like, there's lots of YouTube influencers and other people on there all the time that I feel the key is if apps help support them in maintaining that habit, great. But you don't necessarily need an app, obviously, to kind of get trained or do these skills either.
Right, that's really helpful. UCLA also has the Mindful Awareness Research Center called MARC, and they have guided meditations and breathing as well. Some of the meditations can be as short as 2 to 3 minutes. So that I think is another helpful one that I
Yeah,
just want
yes,
to
that's a great
add.
one. And I think, yeah, same way. I think lots of different providers sometimes keep track of this. And so I think asking PCP, other trusted people, or even friends of what they've used, I think is good. I love your point about keeping it really brief. I think the idea of having kids commit to something like even 30 minutes, I mean, ideally that'd be lovely, but starting with something, again, really small, brief, and apps that set it up where you can just do like a 2-minute intro, I think is a great place to start, as you said.
Would you be able now to talk about the treatments, the treatments that have been tried and true, and let's say what's new and what's happening as far as
Uh,
migraine treatment?
Absolutely. Yep. Great question. So interestingly, it was not until a few years ago. So if we talk about medication side first, then I'll kind of turn over to the non-medical side. But people might know this, but really there was no migraine specific medication for a long time. All the medications got borrowed from kind of other cases or other conditions. So it's kind of luck that we try this one. It seems to work okay for migraine prevention or whatever. But yeah, so I think most of the time, as we talk about medications, we're getting into the category of prevention medications, as in if migraines are happening fairly regularly, we're trying to get in and kind of settle that brain activity down so that they don't happen as regularly. So these tend to be things that you take on a daily basis, although again, it's changed a little bit. I'll get to that here in a minute. But they tend to be fairly well established. Things like there's antidepressant medication, amitriptyline has been really well researched overall. What's called a mood stabilizer, anticonvulsant Topamax or topiramate has been studied in kids as well for headache prevention, and those were kind of the main first line treatments for a long period of time. But interestingly, here in the past little while, we've got a bit more into these migraine specific medications, and as in they're more specific to our current understanding of how migraines work and what's going on in the brain when that happens. And so there's a lot more flexibility in some of these medications now, where rather than taking them every day, you can actually take some of these preventive medications by injection. They are still mostly in the adult world, but there is a new one that got recently approved, even in teens in particular. So again, I'm doing it more injections, which say most people prefer, although some kids have a lot of phobia around that too. So, but the idea with the fact that there's now migraine specific options, I think parents should know that, and not all primary care docs kind of keep up with that. So knowing that, advocating for some of these newer treatments, particularly if you haven't responded and having really frequent migraines before, there is a whole new generation of medications coming out now that I think are really exciting, and give you again different options for how that medication gets in, and less about having to remember to take everything daily and those type of things as well. So I think that newer class of medications has been really exciting for a number of folks, and a lot of people that haven't gotten better with that before. And then the other class, rescue medication, generally the over-the-counter stuff can be pretty good. I like to make sure parent, as in ibuprofen, acetaminophen stuff. I think the main thing for parents to know and kids to know is we just don't want to get into a pattern where that's the go-to response if you're having headaches really frequently. So kids that are having 2, 3, 4 headaches sometimes a week, if you start giving those over-the-counter medications, whatever it is, or frankly, even prescription kind of rescue medications, if you will, that can actually lead to worsening headache pattern over time, where actually headaches start getting more and more frequent. And there's various reasons for that, but definitely important for parents to know that just be mindful of not giving those as needed medications too often, trying to limit it to no more than 3 days a week. Otherwise, it can actually lead to worsening headache pattern over the course of time. So that's why, even more importantly, balance that out with some of these non-pharmacological techniques so you have other options beyond just kind of the go-to medications. But yeah, in terms of medication therapies, like I said, bottom line that I'd like to share with parents is there's a newer generation of migraine-specific treatments right now that not everybody is aware of. Sometimes it is that does mean going to a neurologist or headache specialist might get you a bit more available options on the medication side because they're generally a bit more up to speed and have the knowledge of what current treatments are available, and are able to prescribe that for kiddos. But then the non-medical side, I think we've gone to some of them, but other ones that parents should know about too. So yes, the mind-body strategies definitely want to emphasize lifestyle management. I'll come back to kind of more formal talk therapy here in a minute. Another one that people might not be aware of is what's called neuromodulation. So this is the idea of basically delivering kind of electrical stimulus into a part of your body that basically allows the pain system, it kind of activates our natural pain system to kind of shut down those pain signals. So one for migraine specifically is called the Nerivio device. It is essentially just put on your arm and it's app-based. So it's connected to a mobile phone, and it is prescription, but you can go to the Nerivio website and kind of find out a bit more about insurance coverage and those type of things. And again, not necessarily formal, emphasizing this one, but I do think it's been helpful for a number of kids because it gives you something specifically you can see. It's fairly simple to use. It's delivering electrical current that you have some control over, and can be used now both as needed, but also preventatively or prophylactically to help prevent future migraines with, again, kind of activating this top down or ways that the brain kind of shuts down that pain system, if you will. So yeah, I think of the newer ones, like I said, the newer medications and kind of these neuromodulation devices, I think have been kind of the more recent advances. But there's nothing wrong with the good old tried and true in terms of, again, the lifestyle stuff and learning how to do mind-body strategies. All that stuff has been very well researched, and really important as we think about migraine treatments. And the bottom line for a lot of this too is just having multiple modes, right? So not just relying on medication or just relying on lifestyle. It's kind of that combination of things that are going to be most helpful for keeping headaches at bay and then being able to manage them when they do happen.
So, what about those kids, let's say, who are missing school, are trying all these modalities of treatment and are really falling behind in every way, including socially, which is such an important aspect of the teen years? I mean, can you talk about that?
Yeah. So, I guess a couple responses to that. So one is going back to an earlier point is I do think it's really helpful to come up with plans with the school, and again, being the squeaky wheel in particular about setting up a school plan in the case
Mhm.
where kids have been missing school pretty frequently, because it becomes harder and harder just because how quickly, to your point, how social relationships, they move pretty quickly at the school too. You feel like you're missing out all that. But same way with subjects and that kind of stuff, it becomes very overwhelming the more school that you miss ever trying to get back to that. So, trying to start really early with coming up with a school plan, advocating for that as part of a 504 plan or an individualized education plan. Sometimes having a psychologist or a health professional in that case can be really helpful to guide you on how you might set that up and really kind of setting goals and so forth. But again, it can be done by parents with the school, and most schools are pretty good about working with you getting that set up. But the other the way to answer that too is I think if you're getting into the situation where it's having that level of impact, kids are missing a lot of those activities that are really important to give them meaning. They're missing a lot of school and so forth. It's pretty difficult to just kind of say, work it out and it'll be fine. So I think that's the indicator where I'd say it is helpful to then start thinking about who else do you need on your team to help support that. And I would advocate for a couple things. Certainly having a headache specialist that's making sure they're giving you best recommendations to managing this, because oftentimes that is all it is. It's just finding the right combination of kind of medications and a couple other things, and then you're off and running because it's not happening very often. So it can certainly get better with kind of the basic strategies. What for somebody that kind of knows what those strategies are and kind of how to work with you on them. But sometimes it does require going up a level, and that level being really looking more of a team-based kind of approach for this. A lot of headache clinics are set up that way, or pain management clinics are set up that way, where you will see like a psychologist and maybe a social worker, other disciplines that can literally put their heads together on this has been going on for a long time. And then, so yes, how to kind of help get support at that level. And I can kind of talk about how to access that. But yeah, pain clinics or interdisciplinary clinics, if you could find those type of headache clinics, if kids are really missing out a lot on life and missing out in school, those groups are really good about helping you devise a plan to kind of walk back into life again. Um, uh, so, yep, I think tough stuff, and I'm glad you're bringing all that up because it does take a huge toll, and it is hard just to kind of guide people to how do you actually develop a plan and strategy to get back into life when it becomes harder and harder to do so the more that you kind of getting pulled back from that because of the pain.
Right. Um, just to say that I think CHIP offers a great program for kids to connect to each other, peer support, so they don't feel isolated and alone. I think that's another issue that kids with chronic pain experience, migraines in particular, we're talking about today. Creative activities, so really increasing their resources. There's a question that just came in. How can just talking with the therapist help my child who has migraines? What do you have to say about that?
Love that question. I will answer that in two ways, I suppose, too, or 2 points, I should say. So, number one, parents should know there are different types of talk therapy. And that becomes important because not all types of talk therapy are necessarily based too much on research that's going to be helpful for, as we talk about, kind of migraine conditions or pain conditions in general. So one type of therapy is more general talk therapy, and I have nothing against necessarily general talk therapy, but general talk therapy more as in we kind of go talk a little bit how the week is gone or maybe the past month, talk a little bit about how your feelings have been in that or relationships and that kind of stuff. It's more generally talking through and processing around emotions and that kind of stuff, which can be certainly helpful. But the talk therapy that I really kind of emphasize or put is more almost like a coaching type of therapy. It's much more active. You're learning very specific strategies and skills based on research of the fact that when we're talking about migraine, it is a brain condition again. So we do have research on the psychological techniques that change our understanding of migraine, right? They change components of how the brain is functioning through the application of those specific tools and strategies. So the idea of specific talk therapy, where it is based on science and the idea of neuroscience and understanding of the brain, that's much more this kind of active strategy based. We're working on something at this visit, you go home and have homework and that sort of stuff. It's much more an active therapy, and that's how you know if it's an active therapy because kids should be coming home with something that they're working on throughout the week or a couple of weeks. That type of therapy tends to be called cognitive behavioral therapy. And there's variations on that theme, but you don't have to remember that word per se. But again, I think it's the idea that the types of therapy that are really helpful in this case, it's based on research. It's not just going in and talking in general. So that's what I tell parents is why that can help because it's based on our understanding of the brain. Migraine is a brain condition. Psychological techniques are applied to the brain based on the research of what we're trying to change. So talking to a therapist is helpful if they're giving you information on how to make changes to our current understanding of what's causing migraines to stick around or so hopefully that makes sense. So yeah, it's just a change in the type of therapy and making sure that it's a more active type of therapy. I think we just have more research evidence for why that works.
Right. Okay, that's really helpful. I just wanted to add, and somebody added in our chat here, that CHIP has parent support groups too, which I think is really important when you're working with teens to be able to have a parents have a place to go and
Yes.
learning their own strategies.
Yes. Yep. Good points. Absolutely. I think I can get to that other question too, but I think, yeah, absolutely. I think same way for teens. I think some teens benefit more from that kind of group setting or understanding, and can kind of share a lot of emotional support can come out well from those type of groups. And to your point, parents and their own emotions and how they're responding and so forth has a big impact as well in terms of how kids are handling that stuff. So I think knowing parent access to that is really helpful as well. One question I saw on there too, just the pain reprocessing therapy. I think
Mhm.
so that does fall from my perspective. Interestingly, it's kind of recycling over time of the words that we use in psychology for how we label different therapies. So there are a few different labels within that, but pain reprocessing therapy, I would still put into this idea of it isn't much more of an active therapy, and it hits on what I talked about already. It is based on the neuroscience and understanding of what's important to kind of try to address in kids that are dealing with migraine. So yes, if you're looking for people and can want to ask about if they have experience with pain reprocessing, that is fine. But I think again, the broader category of cognitive behavioral therapy, I think is okay. If you're looking for therapists to kind of use that term, do you have experience with cognitive behavioral therapy? Do you have experience with kids? And so my main recommendations for parents as they kind of look for, if they're looking for psychology support in particular, making sure that they're spending ideally more than half of their time with kids so that they're more of a pediatric trained person and that they do have a bit more background in terms of cognitive behavioral therapy. It doesn't have to be specifically for pain or migraines. Most people are able to adapt to their skill set into this, but it's gravy, obviously, if you have somebody that does have experience with working with kids with migraine and pain. But yeah, so pain reprocessing therapy, in short, is kind of within that category of cognitive behavioral therapy. It has evidence, and so I do think it can be really helpful type of therapy, and kids tend to like it again because it's based on more active kind of coaching, problem solving.
Okay, there's one more question. How does fear of migraines play a role in the experience of migraines?
Uh, Great question too. That is fear at the level of a kiddo or teen, and then fear at the parent level too. So both of those are really relevant, right? So parents' own fear of migraines can certainly make it so that they're a little bit more protective, maybe a little bit more accommodating. Nothing necessarily wrong with that, but sometimes if that goes to the extreme level, then the parents might be really kind of holding their kids back from, well, let's say an extreme like keeping them in the cave, right? But at some point they come out of the cave and can become even more sensitized and so forth. So I think fear can certainly have a role at the parenting level on being maybe so overprotective or over-accommodating at times. And then same for kids. If they get in the habit of saying, I don't want to go out or I don't want to be at school, I don't want to be around people because I worry about the fact that it's going to make my headache worse, then obviously that has a huge impact. And so sometimes that's an area where psychology can be really helpful or working with somebody of getting around some of that fear avoidance type of things. But the parents is more really kind of pushing, guiding, helping support, making it okay to at least pace activities, but be out and about, not fully isolating themselves, certainly in between headache episodes and that kind of stuff. So really trying to support kids on making it okay. To still mentally, it's really important that they're not isolating, they're still being around, doing activities, pacing themselves, not getting overloaded, but not avoiding those activities because they worry that they're going to develop a migraine. That's the worst cycle to get into, is that anticipation that things are going to be bad. So I'm going to give up on all the things that gave me meaning before because I worry that if I do it, it's going to give me more pain.
I have a question I'm thinking about. People of any age, but let's talk about teens with chronic pain are often dismissed, discounted, and that is a really big problem, right? And I'm
Yes,
sure you've seen that too. Obviously, you don't work that way, but you must have heard that story lots
yes,
of times.
yes.
What are your thoughts and recommendations about that?
Interestingly, it's been relatively under-researched even to kind of look at that, even though anybody working in clinical practice in this area, it is one of those health conditions that is uh, often dismissed just by virtue of it's a more of a private private suffering experience for kids and teens. So they get it at school sometimes, they get it from friends, they get it from, like, I know what a headache is. What are you talking about? It's not a big deal. I've had a headache before or whatever. It's all this kind of dismissive under acknowledgement of how much kids are suffering. Again, back to the point of migraine being one of the most disabling health conditions worldwide. So I think, unfortunately, what that does is helps keeps kids even more isolated, right? They don't want to be around people that are just going to dismiss them, or otherwise they said, "You don't know how much I'm suffering, and to show you how horrible this is," and so it really becomes difficult for kids to learn how to navigate that. So part of our advocacy for school too is trying to make sure school personnel are recognizing how much of a negative consequence that has when you've it's just a headache, or I've had headaches when I was a kid. Well, any response like that is going to make it much more challenging for kids to ever get back into life. And same with, as you said, medical providers, unfortunately, if they're not kind of trained or have experience in this, they even unintentionally can make comments like, well, there's nothing wrong with you, or and often talk about migraine is like a software problem, not a hardware problem, as in it's kind of the messages in the system that are what's off, but you can't see it, right? There's no scan or lab test or that kind of stuff. So unfortunately, even the medical community tends to, it's like, I don't know what this is, or I can't see it, so therefore it's not a big deal. Go talk to a psychologist or whatever. So that dismissal, I think, is really important to recognize, to ask about, to validate. And parents do have a role in saying, not you don't spending all time asking about it and trying to reinforce it too much, but certainly it's fine. So I really know how hard this is. I'm so proud of you for how well you're managing this and your resilience and so forth. Validating their experience. I understand how difficult this is. If we can have everybody do that, medical professionals in school and so forth, frankly, I think a lot of this, the challenges would be much less. The school would be on board with, I know how difficult it is. Let's come up with a plan. Unfortunately, that's not too common, and it's more not a big deal. You're just faking it, or you're just missing out, or it's just anxiety. So I really do worry about that level of dismissal, and really try to advocate and fight for that in my own profession. And hope, I'm sure you do as well, but we really want to try to avoid this idea that it's just a migraine. It's not a big deal. Everybody knows what that is, or it bothers me a lot, as you might tell. I kind of get on a platform about that.
Yeah, agreed. So we're coming close to the end. I just wanted to ask you if you could recommend some resources. You recommended a few, some of the apps, and if you have any more you'd like to recommend.
For the school stuff in particular, pretty easy website to remember, Migraine at School.
Okay,
That one has a number of resources on it. So again, it's specific for school, but it has like sample 504 letters, how to go through the 504 process, a type of accommodations at the school that we'd recommend for migraine. There's actually a newer one at Migraine at Work now too. So for kids that are teens that are starting to get into the workforce, or even at the college level, moving into young adults, another great website for understanding your rights at school and so forth. That's a good one. I think a lot of you familiar. I mean, obviously, your site with Chip and the resources on there are great. The
correct.
Meg Foundation, if you're familiar with as well, they have a headache portion of that. The Meg Foundation's got great resources for a headache toolkit, essentially, that overlaps with some of the resources that I mentioned. And then the other one that I mentioned, Headache Relief Guide. Again, not that I'm trying to toot our horns for what we put together, but that has some school stuff on there, relaxation, lifestyle stuff on there as well. And so it has sample 504 letters and other things. So I think that can be a helpful one as well. And then the general ones, Migraine Foundation, not necessarily pediatric specific, but has a lot of good. American Headache Foundation is the other one that has good headache specific resources on there, but not pediatric specific necessarily.
Those are so helpful. Could you
Yes,
actually send those to Chip
that would be
as
easier than
another
me trying to, yeah.
resource?
Yes, I will give you the link. Same with apps and that kind of stuff. I'm happy to send my list so that you have that as a resource.
That's fantastic. I mean, Chip itself has parent groups, like I said, support groups for kids, creating bonds groups if people are interested in finding out about that too.
And
So,
I'll make a comment briefly on that. That I love that this exists, and I mean, I've been sending a lot of folks your way in terms of my own practice as well. I love the fact that we've got so many more of these type of resources, and Chip being one of the great ones. So I do want to advocate for that as well. I think it's the support that you have there and some of the resources that definitely, like I said, jive well with what we recommend for migraine care. So I love that this is yet another resource to start recommending for a lot of our patients.
well, I want to thank you so much. This has been so informative and helpful. I'm sure and hope it's helpful for whoever's joining this webinar today. And I want to remind you and everyone watching that previous CHIP webinars are available on our CHIP YouTube channel. But this was really fantastic. I appreciate all the time you spent in everything that you do with the patients that you work with.
So thank you so much. Appreciate spending my time with you. Thanks.